11 this morning. As many of you remember, a coroner-confirmed actress and singer Lisa Marie Presley died from bowel complications after having bariatric surgery several years ago. The 54-year-old Presley died on January 12th after being rushed to a Los Angeles hospital by paramedics responding to a 911 call. Her autopsy states she had been complaining of stomach pain earlier in the day, and this has now sparked concern, leading to a lot of questions about what's normal when it comes to this kind of procedure. And joining me this morning with more is bariatric surgeon Dr. Christopher Crawford with Ascension St. Vincent. Dr. Crawford, appreciate you coming on this morning to talk with us. First, walk us through what bariatric surgery is.
Yes, thanks for having me.
You're welcome.
So most of these procedures are done laparoscopically, meaning several small incisions, usually 5 or 6, the largest of which is maybe about a centimeter in size. And anytime anyone has any sort of abdominal operations, they're at some risk of forming some scar tissue or adhesions inside. And these scar tissue bands can wrap around the intestine potentially and cause issues. This applies for literally any abdominal operation that somebody has. If it's done laparoscopically, the risk of that is lower than if someone has a large incision down the front, but it could happen with any abdominal operation.
And each patient is different in this case too, I would imagine.
Yes, and which procedures someone has had. You can develop a bowel obstruction after a gallbladder removal, a hysterectomy, appendix, any of those things.
How would you say someone avoids something like this in the first place?
I think one of the most important things is to always be in communication with your bariatric surgery team if you've had bariatric surgery, or if it's a different procedure, someone should be in touch with that surgeon. But things like abdominal pain are certainly concerning findings, especially if it's been going on for some time or if it's severe. I don't have too high of a threshold to tell our patients to come to the ER if they're having severe pains.
What are the benefits? Because I know that there are a lot of people out there who resort to having this because they need it literally to stay alive.
Yes, so bariatric surgery is something that's been associated with dramatic improvements in life expectancy and quality of life for people. Someone who has bariatric surgery can see up to a 90% reduction in their risk of death in the following 5 years afterwards.
Right.
Someone who has some medical issues in their 40s perhaps and has bariatric surgery would see up to 7 or 8 years added back onto their life expectancy by having bariatric surgery. So there's always going to be some risk with having any sort of abdominal surgery, surgery in general, but the benefits and the improvements in life expectancy, quality of life are pretty impressive after bariatric surgery.
How do you know if you're a candidate for it?
So our national and international societies have recently changed the guidelines a little bit, and they're based off of the BMI, and someone with a BMI of 30 to 35, which is considered obese or class 1 obesity, someone would qualify for bariatric surgery if they have medical conditions that are linked to their weight. If someone has a BMI higher than 35, our national and international society guidelines would say that that person could have surgery just based on their weight. We would of course meet with anybody for a consultation and see if they have the right characteristics for surgery, and there's more things that go into it, but most people who have obesity and are interested in having long-term effective weight loss could be a candidate for surgery.
And with anything, always talk to your physician or doctor about any type of surgery that you're planning to do, because they can actually work with you and help guide you through it if in fact you need it.
Yes, absolutely. Most people come to us with a referral from a primary care provider, and then of course everyone meets with a surgeon before they would move ahead with anything.
All right, Dr. Crawford, a bariatric surgeon, thank you so much for coming on and explaining this for us this morning. Really do appreciate it. We'll have this segment posted up on our website for your reference. If you're interested in finding out more, just go to our website, fox59.com/links.